Hello, hello. Can everyone hear me? Give me a big rip-roaring thumbs up if you can. Oh my goodness. Something always happens on the day that I'm supposed to do my live. And today, guess what? I locked myself, well, I didn't lock myself out. I had my key, but this key, apparently the battery died, so it wouldn't open the door. So I was locked out of the van trying to get into it about 10 minutes ago. Finally, I remembered that it had a little button that you push and a little key comes out. So I was able to use this little key to get in. I tell you, oh my goodness. Anyhow, so let's see who's in the house. And I had a call from Greg, who is the expert who's scheduled to be on here. Let me see what he was calling about. Hold on just a second. Let me see what he's calling about. But who's in the house? Kenneth, number one.
Hey, Carol, how are you?
Hey, Greg, I'm on the live, so I couldn't answer. Somehow I got locked out of my car. My battery wouldn't work. So I'm trying to get in my van. I'm locked out. So, what do you're still coming on?
Yeah, so I was calling you because I wanted to refresher of how to connect onto the YouTube.
Okay, I'm going to drop a link right now. And are you on my
I'm on YouTube. I'm on your YouTube channel.
okay, if you
Stories with Life on Wheels.
and if you go to the live, it'll say live.
So I see join.
No, that's if you go and hit live, it'll say have a thing that'll say live.
Okay. Oh yeah.
Okay, hit live, and then you'll see the comments going down there.
Oh, there's a commercial. Let me skip.
Oh yeah, go ahead and
Okay,
skip the
there you
commercial.
are.
Okay, and then I just put in a thing that should have a link. It'll have my name, Glorious Life on Wheels. Go down to the comments, and it'll have a link. It'll say StreamYard. If you hit that, it'll bring you up, and I can bring you up in a few minutes. Okay?
Oh, I see the StreamYard. Okay.
Yeah, and hit on that link, and it'll bring you over to what's called the basement, and I'll bring you up in a few minutes.
Okay.
All right. Thank you, Greg. Bye-bye.
Bye-bye.
Okay, he's ready to go. Come answer your questions. Oh my goodness, I have a video that I'm going to air. It's going to be a short introductory for people who miss this, so I can send them back over here to see this video. But this whole video was prompted by my experience when I was get my hat adjusted here, my bow and everything. Now, if you guys are having problems seeing me because the light in the background, let me know and I'll turn around. But this video was prompted by my doctor asking me about what insurance I had when I was telling her I wanted to go to one hospital versus another. And apparently, if you have certain insurances, including Medicare Advantage, there are a lot of hospitals you cannot go to. So we're going to go over a lot of that with Greg. He's going to answer at the end. He's going to do a question and answer. I'm going to ask him some questions first, but there are a lot of things, and so many people are going to be going on to Medicare in the next 6 years. Over 30 million people will be eligible for Medicare in the next 6 years between now and 2030. So it's really, really critical that you get this right, because there's a certain period that if you don't, it's hard to change. And if you have a catastrophic illness, but I'm going to let him explain that. But let me say hello to everyone, and then I'm going to come back and we're going to bring Greg up, and he's going to explain different things and take some of your questions at the end. Hi, Barry. Hello. I'm not sure I'm in the right place. Yep, it's the right place. I hope it looks the same. Oh my goodness. Yes. I was locked out of my van, but I'm back in now. And hey, Nora. Yes, I am looking so forward to Greg coming on and answering your questions and clarifying some things that can be pretty complicated. Hey, Three Generations, how are you? Who else is in the house? If not now, when? Hello, hello, my great moderator, Nora from Arcuda 2001. And who else? Hey, Vicky Padrin. Oh, my old colleague. Hello. Tim's in the house. Hi, Tim from Bobang for your bucks. Someone was complaining that I greet everyone, but you know what? I'm going to continue to do this because I love to greet all of you. And some people that occasionally come in, this is their only interaction, their only social interaction during the whole week. Some of them are bedridden, some can't get out. And the least I can do is acknowledge them for coming in. So I'm going to continue to do that. Sorry, those people who complain about this, but this is the way I flow. So if you don't like the way Glow flows, you got to go somewhere else. Sorry. Hello. Hey, Linda. Good to see you too. Thank you so much. Hey, CW Style 3 is in the house. Good to be here. I've been keeping you in prayer and for healing. I so appreciate it. You don't know, like I told you guys, when I went into surgery, I felt like I was surrounded by just a flank of prayer warriors going in there. And it just really did something to me. So, and for me. So who else is here? Susie Aspen, hello, and Mary Ann. Oh my goodness, Rebecca is in the house from Rebecca Green Cali. Oh, okay. Let's see. Marcia 1 is in the house. Oh my goodness, I missed that. Vaughn's on a roll. Woo! Sean MacArthur. I may have to come back and say hello to some people because I don't want to keep Greg waiting too long. Kathleen. Hello, Kathleen. Oh my goodness. Yes, you're welcome, Kathleen. You know, this is one of the most important decisions a senior will make is about your health care. And I think it's so important that you get the facts. Now, Greg is not going to go into real specifics on your particular cases because he would have to have your background to do that. So he can't give you advice. He can just provide you with information, and then you can do your own due diligence and research, or I'll drop Greg's link if he has a link and his information so that you all can find him. And perhaps if you need an insurance person to help you go through this maze and navigate through, he'll be the person you'll choose to do that with. Hey, Brenda Berner. Hello. But I'm just so grateful for him being willing to spend this time on a Saturday in beautiful Southern California to come on Glow Live and share with you. So that's just a generous spirit, and I so appreciate that. Wanda, hello. Wanda says, I'm on disability and have Medicare. Between them and insurance, I'm having trouble with some of my prescriptions. Well, depending on what program you're on, I don't know that, but you can ask Greg and he may be able to answer that. May not. It may be too specific and he may have to get more information. Hey, Sean says, thank you for the Medicare information. Oh, you're welcome. I try to give you content that's valuable and that will help you. Hey, RV Butterfly. Hello, back to you. Hello, sweetie yourself. Linda S says, yes, it is very important. All right, I'm going to greet a few more people. Dragonflight Adventures. Hello. And hey, Toll Tracy. Hello. And Sandy is in the house. Yes, I am well after my procedures. Thank you. Hey, Tina. Hello. And Elaine, oh my goodness. All of you, can you do me a favor and hit that thumbs up? It really does help the algorithm and lets YouTube know that I'm doing something of value, but I don't know exactly how it works. I just know it does help. So if you'll hit that thumbs up, I would really appreciate it. And let's see who else is in the house. Chessie's Adventures. Oh my goodness. Says, if you don't sign up for the gap insurance or supplemental insurance in the beginning, can you sign up for a supplement years later? That's a question to ask Greg and he'll be able to answer that. I don't want to give answers because I could give wrong information. I have just enough information to be dangerous. You know how that is. So I'm going to let the expert answer it. All right. Nora says, I was self-employed most of my life and we had to pay private insurance. Medicare is so much more doable than the private insurance. Oh, I know. It can be up to like 1,000, 1,200 a month. And if you have a family, oh my goodness, it could be thousands. But I'm going to go ahead and bring Greg up. I've said hello to everyone that's in the house so far, and I'm going to bring Greg up and let's see, add him to. Hello, Greg.
Hey, how's it going?
It's going good. How are you going? Can you move over a little bit to your right because you're just a little bit out of the frame, or move your yeah there. That's better. That's
I'll probably
better.
hold it. Let me hold
Yeah,
it that way.
that's there you go. There you go. Well, thank you. First of all, I want to thank you so much for coming on and answering some of these critical questions. Now, you are licensed for insurance in the state of California. Is that correct?
That's correct. Uh-huh.
Okay. All right. And I have a couple of questions I want to ask, and then I want to, you to elaborate, and then I'm going to open it up to our audience if that's okay with you.
Yeah, sure.
I've let them know
Sounds
that some of
great.
their specific questions you may not be able to answer because we're not here to give advice because you don't have their history or their background, just to give general information. So,
Right.
now, can you tell the basic difference in terms of the premium? Okay, my understanding, correct me if I'm wrong, there's basically three combinations. There's traditional or original Medicare, there's
Right.
Medicare with a supplemental plan,
Right.
and there's Medicare Advantage. Is that
Correct.
correct?
That's
Okay.
correct. Uh-huh.
Now, can you say on the Medicare, just the basic, what is the premium for just basic Medicare?
Okay. So your Part A is free. That's your hospital. That covers your hospital, your inpatient care, your room and board, just for staying overnight, being admitted. That's free as long as you worked at least 40 quarters or 10 years.
Okay.
It, so if you paid into Medicare over the years, worked at least 40 quarters or 10 years, you've earned free Part A. And that's why most people, they don't have to worry about paying a premium for A. They only have to worry about paying a premium for B.
Now
So
let
the
me
A
ask you.
is free. Yeah, sure.
Okay, can I ask you this? I'm sorry to interrupt you, but as you go, there are questions that come out. And at my age, I forget stuff.
Yeah.
So now, Part A, is there a copay with just traditional Medicare if you go in the hospital? The premiums are for Part A are free, but do you have a copay if you just have traditional Medicare and you go in the hospital? What is your copay?
So when you go into the hospital with Part A by itself, you have to pay just for being admitted from day one. You have to pay a deductible, and this year it's $1,360. And the numbers change every single year, but you have to pay that deductible, and then once you pay that, then Medicare will cover you for 60 days. Um, at that hospital. So for 2024, and I apologize for getting admitted, the deductible is $1,632. This is with original Medicare. Let's say you have no supplement, you have no Advantage plan, you're just bare original Medicare, A and
Now
B.
you said it pays for 60 days. What happens if you're over there in there more than 60 days?
After 60 days, then you have to pay a per day copayment of between days 61 and 90. You have to pay a per day copayment of $408 per day
Per
in that
day?
hospital. Yeah, this is
And,
with
and,
original Medicare. Mhm.
and then what about after 90 days?
And then days 91 through 150, you have to pay $816 each day.
Oh my
And each of
goodness.
those, yeah, and you're in the lifetime reserve days, which means that those days are permanently subtracted from days 91 to 150. It kind of goes into detail, but kind of complicated. But $816 per day for, oh, somebody's playing some music here. I
Okay.
like that song.
So, so that's if you only have Medicare, you don't have any supplement or anything else.
Right.
Now, if you
You're,
have
yeah.
Medicare and you get a supplement, what are the ranges per month of what a supplement plan would cost you?
At 65, from 140 a month to 165. a month at 65. And then every year, if you get the supplement at a later age, it's slightly higher. But that's the average rate at 65 is
But
between
they can
140 and 165.
can they increase it as they like, or do they have to get approval to increase it?
To They can get a supplement, and here's the great thing about a supplement, you can get it pretty much at any time. There's
Hmm.
no supplement enrollment period. As long as you have original Medicare, you can get a supplement at any time
So
of the year.
if you have original Medicare and you don't have a supplement, now would there be a pre-existing condition
To get the
cause?
supplement, yeah,
Say I
not.
had say I had original Medicare,
Uh-huh.
and say I got a diagnosis of cancer, and I was like, oh, I was panicking, and I said, oh, I want to get a supplement. Um, can they say, do they underwrite it? Can they say, well, we won't take you because you have cancer?
Yeah, that's the drawback with the supplement is that you have to answer medical questions to qualify for a supplement. And if you say yes to questions like cancer or recent hospital stays for certain reasons, you can be declined for getting a
Now,
supplement.
if you sign up for a supplement at the very beginning when you first sign up, can they decline you then?
Nope. You can be totally sick, have whatever, dialysis or you name it, congestive heart failure. They cannot deny you a supplement if you get it within your initial enrollment period. And that's pretty much the 6 months after you turn 65. You're in a period of time where you could get one without medical questions. And that's
So if
when
I
people grab it.
So if I signed up for Medicare at 65, I didn't get the supplement, I then got a diagnosis, as long as I went back and grabbed that supplement within that 6 months, they can't deny me.
They can't deny you.
Okay. And the
Yeah.
supplements would be for if I had plan A, and then now the supplements. So plan A is hospital, that's free. So what letters are the supplements? I know there's all these letters. What letters are the supplements?
Yeah. So the most popular is Plan G. Um, Plan G is very, very popular because it covers the hospitalization, it covers everything except the Part B deductible, which is only $240 calendar year deductible. Other than that, if you go into the hospital for 20 days, 50 days, 6 months in a given year, the most out of your pocket is $240. It's that
So
Part B deductible.
if if you're in the hospital for 6 months and having all these treatments, it could go up to hundreds of thousands of dollars. And
A
you're saying
thousand,
that
yeah.
with a supplement, depending on the supplement, which you've paid maybe, I think mine's a couple hundred, I'm not sure, but you're paying that. Now, I think I'm paying $132 for something for Medicare. What would that be?
So if it's 132, it might be your supplement if you got it at a young age. If you got it at 65, that's a pretty low premium for a supplement. Um,
No, that's not my supplement. It's something else. They're taking 132 out.
because I know the Part B premium is 174, and that will
Okay.
come out of your Social Security. So the
Okay.
132 might be another health insurance or long-term care plan that you have, or is it
Okay.
coming out of your checking account or your Social Security?
It's coming out. I've got to double check. I don't want to, let me just take that off the table. I don't want to confuse things. So if you have Part A is free, you can get a supplement. Now, how long will the supplement cover you? Is there a maximum amount of time in the hospital?
Right. So good question. So basically, as you know, Medicare by itself, without the supplement, only covers you for 150 days. Days 151 and after, you have to pay all the costs for your care. So with the supplement, with your original Medicare, supplement will cover an additional 365 days after that day 150 that Medicare cuts you off of 100% coverage. for
So
your
up to
hospital and doctor.
365. What if you're in the hospital for a whole year? Then what happens?
Let's see. So that will be covered because you remember you have your 150 days first covered
Okay.
by Medicare. Then you have an additional year after that of coverage from your supplement.
Now, is it a year? And then what if 2 years later you go back? Does it start all over?
It starts all over again, and you go back into the from day one where you have to pay that deductible again
Okay.
only if you're out of the 60-day benefit cycle. And I'll explain that later how that works because I want to digress that $1,632 deductible just for getting admitted into the hospital,
Mm-hmm.
that's not a calendar year deductible. That is per benefit period. So, and a benefit period starts the day you get admitted into the hospital. You pay that 1,632 Part A deductible,
Mm-hmm.
and 60 claim-free days after you release from the hospital. Um, if you go back into the hospital after that, you got to pay another $1,632 deductible.
So basically, what I'm hearing you say is if you have traditional Medicare without a supplemental plan, if you're in the hospital and then you're out of the hospital for 60 days and go back in, you have to pay that $1,600 again. Okay.
Exactly.
Okay.
This
So
meaning
now,
it's not a calendar year deductible, which a lot of people think it is. I always warn them that's not a calendar year deductible. That's per benefit period.
or per hospitalization and the time that you're in and the break. Now, what
Mm.
about with traditional Medicare versus a supplement? What about doctor's visits and say CAT scans, PET scans, that kind of stuff?
Mhm.
What's the difference between just regular Medicare without a supplement and Medicare with the supplement?
Okay, so basically, with the supplement, no co-insurance, no deductibles, no office visit. It covers all your co-payments, your specialist visits, your primary care physician visits, all of your out of pocket. Original Medicare, you'll be looking, $15 for PCP, $30 for specialists, nickel and diming you here for out of pocket.
And what about for PET scans and stuff with regular Medicare?
Yeah, so regular Medicare, you're looking that's covered by Medicare. You're looking at coverages. Some of them are 20% covered to 80%, so you could be left with a 20% coinsurance. Um, but typically, you're looking at between 20 to a $25 copays for you. In fact, I'll pull that up. I'm glad you brought that up. I'll pull that up right here.
But some of those PET
Um,
scans can be thousands of dollars.
Let me see.
So
PET
if you had a
scan.
20% on thousands of dollars, that could be significant.
Yeah, PET scan. There we
Okay.
go.
So
Boom.
let me ask you this, based on what I'm hearing, just talking about regular Medicare versus Medicare with a supplement, it sounds that if you're just going to stay in regular Medicare, it probably would behoove you, if you're going to have any kind of thing going on, to have a supplement. Is that correct?
Absolutely. People who see themselves being sick, they turn 65, for instance, and they know they're going to incur a lot of hospital stays. They know this is their only chance to get a supplement without medical questions. It is one of the best things you could do for your care because you're getting quality care without the limitations of being in an HMO where you don't get the quality care that you may need for that condition that you have. It's the best plan you can be in.
Now, let me ask you this. So we've talked about regular Medicare just alone and Medicare with a supplement. So now can we talk a little bit about Medicare Advantage?
Sure.
So now what are the premiums for Medicare Advantage? Are there no premiums or zero copay on some or all, or what are the copay on Medicare Advantage?
So LA County and Orange County, there's typically no premium for 90% of the Medicare Advantage plans. So that's one of the biggest things that people like about the Advantage plan. There's no premium. Um, that catches
Now,
their eye, you know.
do you have a supplemental with that, or do you need a supplemental with Medicare Advantage?
No, so basically the Advantage Plan Part C, same thing, is your supplemental, if you will. If you choose the Advantage Plan, you cannot get a Medicare supplement. So you
Okay.
can't have both. It's one or the other.
So if you have
CMS has one.
Medicare Advantage, that's your only plan.
Right.
Now, what are the co-pays or the costs for, say, going into the hospital with Medicare Advantage?
That's what's great about the Advantage plans. I'll pull up an example. I'll probably pull up uh, alignment. Typically, there's no premium, unlimited hospital stays covered. So no
Okay.
deductible, like I mentioned with original Medicare. Unlimited hospital stays are covered. Your PCP primary care visits is $0. Specialist $0. Inpatient mental health. You get your rehab is only $50 after day 21 if you're still in rehab, as opposed to over $200 after day 21 in rehab.
$50 a day or $50 total?
Per day after day 21,
Okay.
it's only $50, which is very good. I know Scan Advantage Plan has $0 for days 1 through 100. So you actually have no cost rehab, which is way more affordable than original Medicare.
Now,
Ambulatory,
some of the Medicare Advantage also, do they cover dental and vision?
yes, because original Medicare typically does not cover dental. It doesn't cover dental, in most cases, vision is not a covered plan. Well, that's the great thing about Advantage plans. It offers additional benefits not covered by original Medicare, like you just said, dental, vision, hearing. Um, a lot of those benefits there you get added on
Now, I
to that.
also heard that it can give you an allowance for groceries or for over-the-counter medication, or how does that work?
Yeah, so for chronic, if you have a chronic condition, you can qualify for healthy groceries up to 100, some $200 a month for free, for healthy, but they have to be healthy, of course. You get a debit card, you bring it to the store, you use credit, even though it's debit. I'll explain that later. And you get to have free groceries, assistance with utilities, paying your utilities, assistance with
Now,
rental
assistance with the
assistance.
utilities, how does that
Mm.
work?
So basically, just to let you know, all you have to do is live there. Your name doesn't even have to be on the utility bill, and you can use your debit card to pay your bill as long as the utility company accepts a debit cards. You can
Hmm.
pay your utilities for that month for your utilities. Durable medical equipment flex cards, so you get additional allowance for walkers, crutches, canes. On
Okay.
top of the embedded DME benefits, you get additional flex card.
Now,
Home.
I heard there was some kind of copay on Medicare Advantage for hospital or something. So, what is that?
So typically, usually plans that are give back plans, like
Mhm.
WellCare has their give back plan where they put $125 back in your Social Security every single month. So you have a bigger Social Security to help you pay your Part B premium. That's great, right? You get a bigger income every month, but your benefits aren't quite as comprehensive. So you take one, what's the catch? Well, you're giving me this money every month. The catch is benefits not as comprehensive. And those plans typically hospital stays 275 per day for the first 5 days, and then free after that. Co-pays of $5 for office visits, $10 for specialists, or $20 for. So you have those give back plans that give you money back, where yeah, you will have co-pays for your office and specialist visits.
Okay, so through Medicare Advantage, you have copays for that and for hospitalization. And then what about if you had chemotherapy? What kind of, because I can hear that could be hundreds of thousands. What kind of copay would you have for chemotherapy?
Well, the problem with chemotherapy. Chemo is typically a Part B as in boy drug, not a
Mhm.
Part D. And the problem with
Okay.
that is, remember, Part B is always going to be 80/20. So that means Medicare will only cover 80% of your chemo,
Now, what if
leaving
you're in
you
the
with a
Medicare, if
20%
you're,
out of pocket.
but if you're in the Medicare Advantage, are you still paying that 20%?
Yep,
Okay.
exact same
Now,
thing. So the Advantage plan doesn't really help you in that area. It's pretty, yeah, with
now
the
I
chemo.
saw, I was watching someone, a video somewhere, and they were saying where their chemo bill for their mother was like $400,000.
Mm,
So if that was the case, then they would have a chemo bill of $80,000 if
mm,
it's 20%. Now,
right.
under Medicare with a supplement, what would your what would you be paying?
Zero. That's why people get the supplement as well, because remember, the supplement is covering the 20% that Medicare doesn't cover. So that
Okay.
chemotherapy will be a $0 balance
But
for the
Medicare
client with the
Advantage won't
supplement.
pay that 20% for the chemo and stuff.
Right. It's only 80/20. And they say it on each of the schedule of benefits for each HMO PPO. They
Okay.
let you know that's
So you're paying
80/20.
less per, so here's what it, and here's some research. I'm going to refer to my notes. Here are some of the things that I've been finding out about Medicare Advantage. So it sounds like there's some really good things about it, but it sounds like there are also some problems. What I've been reading is that Medicare Advantage scripts dropped out of Medicare Advantage last year, and that's a
Right.
huge medical care provider. I've
Right.
also heard that 15 other major providers dropped out, and a number of others are considering. And these are reasons that I found. And can you comment on these? They said that they have a high first of all, you had to get pre-approval for different procedures.
Hmm.
Whereas with my medical supplement, I don't have to get pre-approval. And they
Right.
said that there is a higher than average denial rate of coverage for a lot of procedures. Have you found that to be the case?
Yeah. So that's the thing that's common with the Medicare Advantage plan is not only do you have to wait for prior authorization, but a lot of them are denied. Um, with Advantage plans, I think I mentioned this to you. We were talking. These are companies. These are businesses. They have a board of directors. They got a CEO, and every business owner's goal is to make a profit, right, and save on
Mm-hmm.
costs. And how do they do that? Well, by referring you to a doctor who may be below who you need for your condition, because they're business owners. They're trying to make a profit and save on costs, but now your quality of care is compromised. And so that's where you have this love-hate relationship with HMOs and Advantage
Yeah,
plans.
they said that there's a high rate of denying of coverage. You have to
Mm-hmm.
get pre-approval. That
Mm-hmm.
they only reimburse at approximately, based on studies, 80%, 86% of what Medicare pays. So they don't pay the doctors as much for the same kind of
Mm-hmm.
procedures. That the access that they can't refer to a lot of specialists that they might want to
No.
refer to because they have a more limited roster of hospitals. A lot of hospitals, and this is what caused me to do this program to begin with, because my um, one of the hospitals I was looking at, Medicare Advantage wouldn't pay for me to go to that hospital.
Right. Unless
So
it's an emergency.
yeah, so there were restrictions on the hospitals that you can go to under Medicare Advantage. There's also restrictions under the for the um, specialists that you could go to, and they said that patients enrolled are less in Medicare Advantage are less likely to receive the high cost life-saving treatments that they may need that those in original Medicare would be able to access. Are you finding that to be the case?
Yes, 100%. Absolutely. It's if you're really, really sick, and people love their HMOs. They say, I love my Kaiser, I love my plan. But the minute you really need care and need help, or you have health issues, that's where you get a different opinion, because now you're frustrated. You're frustrated by everything you just mentioned. Um, it's not for people who are really who have a lot of health challenges, I
Now,
would
this
say.
is what the CEO of Scripps said when they dropped their. He said, there are patients out there that can't wait. The delay of a cardiac procedure or cancer procedure could be life threatening. That was, he said. So he, as a doctor, he was saying that there's so many delays. Uh-oh, we lost Chris. He said there's so many delays that it can cause a problem in getting a timely response, or you have to appeal the denial. And if you have a serious cardiac problem that needs surgery or serious cancer that needs treatment, that it could be life threatening. Oh my goodness. Hold on. Hopefully.
Sorry, I'm back. Sorry about that.
Okay. All right. So basically, so here's what I'm hearing, and let me know if I'm correct in assessing what you've said and what I've researched. If you're really sick and have something that's going to cost a lot to deal with, or may have, like a transplant or something that may be out of the ordinary level of care, you may have a problem getting the care you need under Medicare Advantage. Would that be an accurate statement?
Yes. Um, and if you if you do have a lot of health issues and your income level is at a subsequently, a decent level, uh, the supplement will be the utmost best recommended suggestion, if you will, for a
Okay.
client who wants that quality, who needs that quality care
So what
for
about a
these
person
serious conditions.
what about a person who's on Social Security living on maybe $900 a month, is barely making it?
Mhm.
If they don't have, the option of paying the extra money for the supplement, rather than have strictly Medicare, um, that's a hard question. So having just basically Medicare and rolling the dice without a supplement, or having Medicare Advantage, what would be the advantage of one or the other if you're really low income and can't afford it? What would
Yeah,
be the
so
advantage?
they would qualify for the dual special need plan. And when I say dual special need, it's only for people who have both Medicare and what we call Medi-Cal or Medicaid, same thing,
Okay.
that where the state will cover all their out-of-pocket costs and they would pay nothing. And because of their income level, they qualify for a lot of additional benefits, including home care, um, IHSS above Medi-Cal, and then all the groceries, the vision, hearing,
Now
$4,000.
that's in
Hmm?
California. And how would
Uh-huh.
someone on a really low income qualify for that?
So basically, if the income is, it changes every year, and I keep forgetting. I apologize. 1,428 per year. You may have looked that up. If your annual income is at that level or less, you can qualify for Medi-Cal. And once you get Medicare and Medi-Cal, then you can qualify for these excellent dual special need plans, or we call them DSNPs, that will give
Mhm.
them the extra meals, coming to their home, and all the debit cards for their, extra benefits
So it's
and
kind of like
unlimited coverage.
they get some of the coverages that we are seeing then in Medicare Advantage, it
Right.
sounds like. Okay.
Only
So
a lot more. Yeah, like their debit cards will go from like $200 a month credit for groceries to $500. Like Alignment has a DSNP plan that increases from 200 to 500 because of your being on Medi-Cal.
okay.
And yeah, they're well taken care of as far as benefits are
Now
concerned, or extra benefits.
that's in California.
Correct.
Now, so do these plans change a lot from county to county within the state and from state to state?
Yeah, so like Orange County, for instance, doesn't have a dual special need plan.
Oh, really?
They don't. LA County does. So in Orange County, You could still be on Medicare and Medi-Cal, however, and
Hmm.
still get extra benefits. It just won't be a dual special need plan. Um, so that's the only thing that's different. That's interesting. You know, they don't. There is no DSNPs in 2024. That is 2025. We'll see. Um,
Now,
um,
in so also do the benefits vary? I guess the basic Medicare is across the board because it's a federal program. But now
correct.
the other things would vary from state to state. Would that be the case? What? Okay.
Yeah, definitely. So with California, and I can't speak for Idaho or Wyoming, but I know that the Medi-Cal benefits and the dual special need plans do cover their clients uh, well, if not better, than California. Some states not so much, but yeah. Unfortunately, I can't speak for the other states outright,
Okay.
but there are programs for the low income, from county to county and state to state.
Okay. So
So
if you had a mom, and so we're not giving advice here, but if you had a mom who was very, very low income and had major health issues but was very low income, what would you recommend in California that she do?
for my mom, I would put her like let's say my mother's diabetic. Um, she's low income. I would put her in Alignment Health Care is one of my 13 carriers that I contract with, and Alignment Health is incredible because they cater to chronic illness and low income, and they'll give her the unlimited care that she needs with
Now, is
benefit
that in
card.
Medicare Advantage or is that
Uh,
in, okay,
yes. So yeah, just make it clear. So DSNPs or dual special need plans are an example of Medicare Advantage plans
okay,
or
okay,
Part C. I didn't make
okay,
that clear. Probably should have. So yeah, we're all yeah. So just to simplify, there's only two ways to help cover Medicare. One is the supplement that we talked about first, and the
mhm,
second is the Advantage plan. And within the Advantage plan are these dual special need plans. So I hope that kind of
okay,
simplifies what we're talking.
okay. All right. So let me go, if you don't mind. I'm going to start with some questions. So anyone who has a question, can you put it in right now? I do see, I'm not going to go back way up to the top questions. So if you have a question, could you put it in right now so I can read it to Greg and he can answer? Now, let me ask one other question.
Sure.
I have a lot of viewers who travel all over the country. So if you have Medicare in one state, can you get treatment in another state?
Only on an emergency and an urgent basis. So remember, the
Okay.
urgent care works as well, not just emergency. And the difference, urgency is like, emergency is life threatening, right? And then
Okay.
urgent is, where you need care now. That's covered wherever you are. You have
Okay.
to call your doctor once you're stabilized. Get Let them know where you are, what happened. You got to get prior approval with any post stabilization activities that the doctor may do because
Okay.
your
So once,
carrier might not accept it. It might not
okay, so
accept
you're
that.
saying if you have an emergency, let's say you have a heart attack or you get COVID or you get really sick and you go to the hospital, that's covered. But once they kind of get you stable, you've got to call your doctor and get them to get it authorized for any more care.
Correct, because what they
Okay.
do may not be covered within your particular plan. So you got to get that prior authorization for any post stabilization care from your carrier.
Okay, so if
Mhm.
you have regular doctor's appointments or checkups or these kind of things, then you would have to go back to your area of residence.
Correct.
Okay, or
Correct.
your state. Okay.
Right.
All right, let
The
me look.
address that you used. Yeah.
Okay, let me look and see some information. I have a question here. RV Grandma Charlotte says, I have a friend, Washington, that is on the dual Medicare Medi-Cal. She gets the perks and better medical care at no cost than I get with my Medicare and supplement. So she's saying someone on the dual care is getting better than she gets with her supplement.
Yeah, they get good coverage. I sit with a lot of clients and they're frustrated. They see all the benefits are going to these people, and I got to pay my mortgage, and I got to pay this, and I got to pay extra premium for my Part B because I make above 85,000. I don't know if that's called IRMA or something. So they're upset. They're paying, but
Okay.
honestly, that to answer her question though, if she has a supplement, um, I can't imagine, because
So probably all
the
the perks you
DSNP
said,
being
like,
better, because the perks are great, but at least you can go to any doctor you want in the country. You can go straight to your specialist without waiting for a referral. I would take your plan over your friend's plan any day. The additional benefits, I think my health is more important. I mean, the additional benefits are healthy, but yeah, I still think the supplement is the all be all of of coverage.
okay. All right.
Mm.
Um, Mo Bang said, "Is a toss-up decision when making a decision which way it all depends on your future health." It really does. Oh, I know what I wanted to say.
Yeah,
So
sure.
if you are, and I want to make sure that this is made clear. So if you are sign up through open enrollment between October and December,
Mhm.
but then you get into the plan and you hate it, you are saying that there's a period that you can fix it?
Yep. From January 1st to March the 31st, where they have what we call an open enrollment period, where you can fix what you did wrong and
Okay.
change to another Medicare Advantage plan, or go back to original Medicare and get a supplement, or make those
But that's
changes then.
only if you changed between December and October?
Correct. So you can use the OEP to correct what you did wrong in the AEP. Correct.
Okay.
Mhm.
All right. So now also this is really important that you and I
Oh,
had
I'm sorry. I want to back up. I'm sorry. In the OEP, you can also make a change even if you didn't change during the AEP, October to December. Sorry.
Okay, so
Yeah.
what's the difference if you can change in both? What's the difference? I don't get the difference.
Yeah. So I guess the difference, some people made the mistake of not changing. They didn't, like Sarah, maybe she didn't read her schedule of benefits for
Mhm.
2025. And in
Right.
those schedule of benefits, she noticed a decline in her coverage for pap smear, for acupuncture or whatever. She's very unhappy. Uh, Now she wants to make a change out of this plan that she didn't move from. She has that opportunity January 1st to March the 31st.
Okay. Now, one thing I thought was very important when you and I had a private conversation, and that is if you go if you're on a Medicare supplement and you decide supplement plan, you decide, well, this is just too expensive. I can't afford these premiums. And you change over to Medicare Advantage because you want to get all the perks and you want the no premium. And then you have a major health problem that comes up and you're like, oh, I better go back over. They can deny you, you were saying.
Right. Because then, yeah, they can ask you medical questions, and then you won't qualify. If a sudden illness hits you, and then you can be denied. Now, I
So
do want to
they,
say this.
okay.
There is a window that they've started now where if you go to Advantage Plan because you can't afford the premiums of your supplement, you do actually now have a window, a 6-month window that you can go back to your supplement without medical questions, actually. So that's a good feeling knowing that, but it has to be within the first within the first year. You can say, oh my goodness, I don't want this Advantage plan, I don't like networks. You can actually go back without medical questions as long as you do it within the first 6 months, sorry,
So
of that
even if you
change.
get a major health problem, you can still go back?
Yes, as long as you
And then
do it
you
within that 6-month window.
and then you
Hmm.
were also, but that's always subject to change, so they do need to keep up with
Yes,
that because things do
right,
change. Now you were also saying that there are holidays periods where
right.
now
So
what is a
yeah.
holiday period?
So Blue Shield is the only company that does this, and they have what we call a holiday underwriting period, where the underwriters go on vacation, and you're allowed to get a Medicare supplement without medical questions. And it
So how
usually
would you
happens
find
around the
out?
holidays.
How would you find out when that happens?
So we get told like a month or 2 months in advance, and then
Okay.
I'll call my clients and let them know. And it's great. It's a great way to just get into a plan without medical questions, and it usually lasts about 4 to 5 months at a
Okay.
time. Yeah.
So every once in a
Those
while they will do that, but it's not any guarantee.
Right. We haven't had one in almost a year now. They haven't had one. This is the longest drought they've had of holiday underwriting with Blue Shield. So
Okay.
hopefully they're due for that. And then I always call my
Okay.
clients, here's your chance.
Okay.
Yeah.
All right. Now let me see it. Barbara says, if you work until age 70 for an employer that provides your health insurance and you only sign up for Part A at age 75 and wait until age 70 when you retire and then go on Social Security and Part B, can you do that? Can you, if you have an employer that provides you health insurance and you only sign up for Part A at 65, is there a
Mhm.
problem trying to go back to go to Part B at 70?
Not at all. As long as you do it within 63 days of you losing your group coverage, you will
Okay.
not be penalized. And
All right.
that's your
So
open enrollment right there, I guess.
so if you um say you're retired and you have no, your private medical, and at 65 you don't sign up for Part B, what is the consequence for that?
Nothing. There's no penalty as long, Carol, as you have credible coverage through your group insurance. And when I say credible coverage, that means it has to be at least equal to or greater than Medicare.
And if you don't, then what?
Then you will be penalized like 1% of the gross annual cost of premium every single month that you don't have Medicare, and it
So if
kind of
you didn't
accumulates every year,
So if you didn't
lifetime.
have it for 2 years, that would be you'd be paying 24%. And is that for just that year or forever?
Forever. So it will never. You, that's a lifetime payment that you'll have to pay for your Part B for the rest of your life. So the longer you take, um, the bigger the penalty can be, lifetime.
Okay. All
And
right.
the
So
company, by law, has to tell you or give you a letter stating that your coverage is not credible as a warrant. They have to let you know.
okay, so they have to let you know this coverage is not m- consistent with or equal to Medicare, and you may be penalized if you don't expand it.
Correct.
Okay. All right. Wow, this is a lot of information. And so Susie Aspen says straight Medicare, you wouldn't need to get permission out of your state on straight Medicare.
You can go anywhere you want. You are totally free to go anywhere with straight Medicare. No networks, no nothing. You can go anywhere you want for your care.
Now,
As
out
long
of
as they accept Medicare. I'm sorry. I got to make that clear. As long as that doctor accepts Medicare.
okay, but I understand that about 90% do accept Medicare, is
There's a
what I
high percentage. Yeah.
okay.
So you're pretty much okay with that. Yeah.
All right. Now, Ferry just says, is Medicare automatically given and payment is taken from your SSDI, even if you never signed up for it because you're under 60?
The only time they'll take the only time Part B will take their 170 monthly premium out of your Social Security is if you already have Social Security. Um, then your Part B will be automatic. It'll start automatically, and the first payment will come out on your birthday, your 65th birthday. If you don't have Social Security when you turn 65, then you have to sign up for it physically. Go to ssa.gov or go to Social Security and sign up for it because it's not going to be automatic.
Like me, I would still be panicking. So I would want to call someone and find out. Who would I call to find that out to make sure
About your Medicare status or about signing up for Medicare?
about if I needed to sign up or if I was going to be automatic? Who would I call to find that out?
So basically, Social Security or ssa.gov will be your two sources to sign up for Medicare, and
Okay.
you'll become entitled to Part A automatically at your 65th birthday, because you worked 40 quarters or 10 years, and that's free. So people just get their entitlement to Part A at 65, and
Do
then
they
Part
but
B you'll have. Go ahead.
do they have to sign up for Part A?
No, it'll be pretty much automatic. The Part A will be because that's the plan that's the part that they're entitled to on their 65th birthday.
Okay. So it's
And then
Part
the
B
Part
that
B they
you
have
have
to
to.
enroll. They have to
Okay.
actually enroll in Part B.
Okay. Someone says, I have my own medical insurance through my retirement package. So it was a surprise to find out that I have Medicare and never signed up for it.
Hmm.
So she
You
probably has Medicare Part A, but maybe not Part B, I'm
can you
thinking.
ask her
Do
maybe
you
if
have
she's
Part
there?
B, Fairy Dust, or do you just have Part A? She has SSDI, which would be Social Security Disability Insurance. So if
Okay.
you have Social Security Disability, are they taking it out automatically? If you said if you already have Social Security, if you had disability,
And then she has okay, and then she has her Part A and Part B.
so
Um,
are they? So if they're taking it out, they must be. Are they taking it out, Fairy Dust, or not? I'm a little confused that. So when you turn 65, you are already signed up for Medicare. Someone's asking.
yeah, well, yeah, you're entitled to Part A, but with Part B, you have to enroll in Part B unless you're already getting Social Security.
Okay.
If you're getting
Now,
Social Security, then Part B will be automatic.
Now, if you're getting Social Security, Part B will be automatic, but just me, I would double check because
Right,
I'm so
right. And it's so
compulsive.
simple.
I would still go down. I just
And
okay.
just to let you know, call Medicare first because you're not on hold more than 7 minutes. And they can let you know the status of your Part A and B. Um, but it's Social Security where you enroll into Medicare, but you're on the phone for like an hour and a half. It's a nightmare. That's why I always try to go online, create your username and password, and just enroll through Social Security.
Okay.
And there you can find out your status, as well as enrolling in Part B.
Yeah, Barbara was asking this question. I think we've already answered it. Does enrolling
Sure.
in Medicare Advantage plan and decide to switch to traditional Medicare and supplement, do you have to prove insurability? So you're saying you do have to prove that after a certain number of months.
After that certain number of months, right? You have to show evidence of insurability after that 6 month period to show
Okay.
that you're healthy to qualify for it. Yeah.
Okay. Denise is saying, I believe oh yeah. Um uh okay. Okay. Yeah, yeah. If you have a rare thing, Denise, it can be a real problem. Um Tim is expressing the opinion. He says if you travel all over, do not get Medicare Advantage. So,
Like
uh,
travel within the states, yeah, or like within the cities or the states or the country, you mean?
now, what about going out of the country? What about going to Mexico or Canada or even Europe? What is the
So,
status there?
so for instance, so with the Medicare Advantage plans, they typically you have to pay and then get reimbursed. Some carriers will give you $25,000 worldwide coverage. Some plans will give you $50,000 worldwide coverage, depending on the carrier that you're with. Um, and you'll get your with the HMO sometimes, and you'll get covered there up to that amount.
Now,
With the supplements,
is that just for
y-
emergencies?
correct, correct.
Okay. So
Hmm.
it would be a good thing before going out of the country to find out what your plan will and won't cover and how much they will cover and whether it's reimbursement or what, you know. It sounds like
Right,
from what
because yeah, because if it's like 25,000 and something really serious happens to you in New Zealand, and that's kind of a low amount, 25,000. It wouldn't hurt to get a little travelers insurance as well, because they work hand in hand to help you with any gaps in your worldwide coverage. The
Anytime I go out of the country, or
Mhm.
sometimes even not even out of the country, I get traveler's insurance because sometimes if I'm going to be somewhere and I don't know what the medical care is there, I want insurance that's going to cover a medical flight back to somewhere where there's good medical coverage.
Yes.
So and a medical flight can cost 50, $100,000. So I always get medical, and you need to do it. I'm not a medical insurance specialist, but some of these travel insurances, you need to do it within so many days of making a reservation or of paying for something, but you can't, make your plans, make reservations, and then 6 months later go get some of them you won't be covered for pre-existing conditions. So you really need to check that out. It's very important to check those out. But I always get travel insurance if I'm going out of the country, you know.
Another reason to get travel insurance, some countries won't treat you until they get a payment. And if you're on a reimbursable plan only, you can be in bad shape there. That travel insurance can kind of be there, help you out with that.
Okay. Well, let me look and see. Deb S says I pay $297. I can't
Hmm.
afford it, but I don't want a disadvantage plan. Too many restrictions.
Disadvantage plan. I like that.
But there are that if you really want freedom of choice, it doesn't sound like the advantage. If you want really wide open freedom of choice, it doesn't sound like the advantage plan is for you. It sounds like
Right.
the Medicare with supplement. But if you want low payments in terms of the premium and you want a lot of the perks, so I guess you just have to weigh it for your situation. And if you think if you have a big family history of cancer or cardiac and some of these other things, I think it's like rolling the dice, you know?
Right. And then I want to say, if you're healthy and you have a healthy family, you're more okay. Maybe you can consider the advantage plan, right? Because you're, but then again, we don't have a crystal ball,
Yeah,
right?
yeah,
So
yeah.
it's yeah, it's just income and whatever's comfortable financially and your health. Put those two together and kind of make a decision. And yeah,
All right.
it's interesting
Susie
decision.
says you have to sign up. It's not automatic. You get fined for, yeah, yeah. If you already have Social Security, according to what Greg is saying, you are signed up. But I would still check on the Part B because I'm just compulsive like that, and
Yeah,
anything that's going to cost me money in the future, I'm going to double, triple, quadruple check because that's just me. All
right.
right. All right. Trying to think any Lisa at Outdoor Dash Travel says my mom had that as she didn't have Part D for a year. She had the penalty every year. So Part D
Hmm.
now, as far as medicine, what how are medicines covered under Part D, whether Advantage or regular Medicare? How does that work for medications?
So Part D has the same stipulation as Part B as in boy, where if you don't have credible drug coverage and you don't get your Part D, you can be penalized the same way, the 1% for every month that you don't have your Part D coverage.
Okay, so for Part B and for Part D, B is in boy, D is in Donald, you need to make sure within how many days of turning 65?
It's your enrollment. It's your initial enrollment period, which is uh, the month you turn 65 plus the additional 3 months. It's a 7 month window. 3 months before birth month, your birth month, and the 3 months after. You have to choose a Part D as in dog drug plan as well.
Okay.
Otherwise, you could face a penalty for not having credible drug coverage.
So if you didn't sign up for either Part D or Part B, and then you wanted to do it 3 months later, at that would be huge. You'd be paying almost 50% or more.
Right.
That
So
that could
yeah,
be very big. Yeah.
And
All
then
right.
if you choose an Advantage plan, you get your Part D automatically because most Advantage plans have their Part D built in with it. So you satisfy that, you're fine. But
Okay.
yeah,
Mart,
it's scary.
Ma- Martina says she got Medicare card in the mail at 65 and got the additional coverage from a broker. All right.
Good. Good
All
for her.
right.
Good.
Okay. So, Greg, let me ask you something. Can we get your information in case someone is not signed up, or I didn't know you then, but I went through a trusted insurance, who since retired, insurance agent, because I knew that there were things that I could easily mess up. I didn't understand, and I
Right.
didn't have vast knowledge. So if someone um, is in California and wants to reach you, how would they do that?
Yeah, sure. Okay. Greg Miller, and my phone number is area code 310.
Hold on, let me put this. I'm gonna do okay. I'm gonna
Okay.
put this down. Hold on. So Greg Miller, uh, and your phone number is
It's area code 310
okay.
402
402
3798.
3798. Okay, I'm posting. Let me repeat it: 310-402-3798. So
Correct.
if people have questions, is it okay if they call you?
Yes. Anytime.
Okay. So if someone has a question you want to ask Greg about, and he specializes in California. So, if you're in Mississippi or Louisiana, I'm sorry, but it's going to be in California. Or you can answer general questions about just Medicare, the federal program, that's not tied to states.
Right.
Okay. All right.
And I
So
have
again,
colleagues who have licenses in other states as well. I'd be glad to refer them to if they're in that applicable state. I can help them with
okay,
other
all
people.
right. Greg, is there anything that you didn't cover, I didn't ask? Let me see if there's any other questions that um, we did not cover and you weren't asked that you think is really crucial for people to know.
Just two things. One, anybody whose supplement is a little high monthly, because I represent all the carriers. Um, you're probably paying a high premium because you're in a sick pool of people where that carrier is paying a lot of medical claims, so they're
Hmm.
forced to increase their premiums. And what my job is to move them into a carrier where they're getting the same benefits, same supplement, but paying a lower premium in a healthier pool of people. I could help you lower your rates on your Medicare supplement. That's number one. Number two, uh, as you guys know, unfortunately, none of the Medicare plans, nothing that we talked about today, whether it's a supplement or an Advantage plan, covers long-term care. And long-term care is the number one cause of people, losing their retirement portfolio, being a burden on their daughter, their son, and not getting the care because the government pays literally zero for extended care. And I help people in that area as well to enhance their current coverage. So those are two. That second one is a crisis. I'd be glad
Right.
to answer any questions about in the future.
Okay. And you were also talking about just, you know, the how from what you're for people who don't know what long-term care is, if someone needs to be in a nursing home or needs to have someone come in and take care of them in their home, how to get that provided for, especially people who may not have family or children. If you get very, very ill and need care, what little you have could be depleted within a couple of months, if not less. All right. Well,
And
Greg, thank you so, so much. And
thank
Greg,
you.
could you repeat your phone number one more time for people who, in case they don't see the link that I dropped?
Sure. It's area code 310 402, sorry, 3798.
One more time.
Sure, yeah, that truck came by.
Yeah, yeah.
Area code. Hold on, I'm gonna let this car pass too. Okay, it's area code 310 402 3798.
Okay, I do have one question here. If your spouse doesn't have the required 10 years of paying into Social Security, will she still qualify for Medicare under her husband's Social
Husband.
Security benefits?
Yes. I just helped somebody with that last week. So she's using her husband's social security number for her Medicare eligible. Good question. Yeah, I forgot
Okay.
to mention that.
Thank you, Tim, for that question. All right. And how would they go about doing that?
So they sign up. They'll sign her up for through SSA.gov. So I helped them navigate the website. He was tech savvy, so it really helped. He created his own portal and signed her up through the website, SSA.gov.
Now, do they have to have been married for a certain length of time?
Yeah, typically there's I believe it is 10 years. Yeah, 10
Okay.
years married. Mhm.
So it's the same thing in terms of to be able to collect the person's Social Security, you have to be married to them for 10 years, is what I
Right.
understand. Okay. All right. So you can't just marry someone and then if you don't have insurance, go marry someone real quick and get under their insurance. Okay. Okay. Well, Lindy is in the house. Oh, welcome, welcome, Lindy. Oh my goodness, go over and check out Lindy's video. She had a heart attack. So go over
Wow.
and check out Lindy's video. So she is very cognizant and knowledgeable about trying to get medical care. I when I was in the hospital, they were talking about, because they heard me talking about this, and they shared with me, some of the hospital staff, that there was someone who was in the middle of chemotherapy and their Advantage coverage, the place where they were getting their chemo dropped Medicare Advantage, and they had to stop their chemo and scramble to try and find another provider.
Whoa.
So that's really serious, and a lot of, I mean, they just stopped in the middle. You know,
Wow.
can you imagine
Right
chemotherapy?
in the,
Yeah,
yeah. That's wow.
yeah. Yeah. Marilyn says, I don't take Social Security and work. If I don't take Social Security and work at 65, I had to enroll in Part B to keep my widowed military benefit. I had to pay for Part B out of pocket till I drew. I'm not quite getting that. Are you getting that, Greg?
Yeah. She has to pay her Part B premium. Um, she'll continue to have to pay her Part B premium regardless, unless she's on Medi-Cal. The only way you avoid paying your Part B is if you're on Medi-Cal, where the state is paying it for you.
Okay, she is apparently a widowed military benefit. She had a widowed military benefit, she said.
Uh-huh.
Okay. All right.
And I believe a lot of them require you to get Part B. So that's probably what happened. They probably required her to get Part B regardless for her
Okay.
to have that widowed benefit. Good
Three
question. I'll have to
generations, that's not quite accurate. Three generations. Three generations says never give up your original Medicare. I was told if you give up original Medicare for the Advantage plan, you give it up for life. Well, no, not necessarily. If
if you're
you
on
have
sponsor.
if you have a major illness come up, it could be a challenge depending on when you try and get back into it. But also,
Right.
they can charge you higher premiums. Is that true, Greg?
For the supplement, can charge you a higher premium
If you go in
if
with a
you're
pre-existing condition.
no. Basically, they'll for a smoker. Yeah, they can rate you if you have like, hey, let's not decline Sarah. Let's rate her a table C where she pays a higher premium, or she takes tobacco, so they'll rate you as a standard instead of preferred. Your premium can be higher for those two reasons for that supplement, or they just decline you.
So they can either rate you as a higher risk and charge you more, or they can decline you.
Decline you, correct.
Okay. All right. So, yeah, I would just say before making a decision to change from one plan to another, especially going from regular Medicare to Advantage, I would consult with someone like Greg, to get the pros and cons. So I'm not saying don't do it, do it. I'm just saying whatever decision you make, do it being well informed, so you have an idea of what the benefits are, what the pros are, what the cons are, and you go in making an informed decision. I think that's the best thing. Just make an informed decision, you
Right.
know, rather than one without, Um,
Right.
well, Greg, thank you very, very much. What Susie says, is there a good helicopter insurance plan? I live in a rural area and would need to be airlifted to a city. Does Medicare cover that?
Alignment Medicare Advantage plan has a good air support coverage benefit. That's pretty impressive. Alignment Health is probably one of the best. I just got appointed with them a year ago, and a lot of my clients love that because of those benefits, especially the helicopter and the air transport coverage, where they'll waive the cost. A lot of these plans, if you're admitted, which many times you will be. Um,
So if you take a helicopter, they get you there and say, "Oh, you're fine," then they're probably not going to pay for it.
yeah,
Okay. But if you take a helicopter there and they say, "Oh, yeah, this is an emergency," then they, may pay. Okay. All right. So don't call them if you get a scratch to be helicoptered out. But you're saying there are plans that will address what Susie Aspin is saying, that if you're in a because if you're in a rural area, you may not have care right away. And if you're really, really sick, taking an ambulance can take too long, perhaps.
yeah. Like for instance, outpatient care, ground and air ambulance services. It's a $100 copay.
Okay.
It's pretty good for for the air transport, for ground and air, and you get that $100 back if you end up getting admitted into the hospital. And this
Okay.
is with the Alignment Medicare Advantage plan.
Okay. All right. So again, I would suggest Greg is very knowledgeable if you're in California. And now, is alignment outside of California too, or just in California?
It's um it's in Alameda, Fresno, Los Angeles, Madera, Marin, Merced. These are the counties: Orange, Placer, Riverside, Sacramento, San Bernardino, San Diego, San Francisco, San Joaquin, San Luis Obispo, Santa Clara, Santa Ventura, and Yolo
Now, do you know, is it
counties.
outside of the state of California or only in the state of California?
That I don't, not sure. I don't want to say
Okay.
yes and it's not. Good question.
Okay.
I can check that out.
Okay. Well,
Yeah,
I'm
these are
looking.
only the California plans. Oh yeah, I was looking at California. Yeah.
Okay. Chessie says she has the Advantage plan HMO, but rarely uses it other than yearly checkups. And if that's all you're using it for, that's excellent. That I had a doctor tell me once that Kaiser was basically a well baby program. And if you had a really exotic thing or a really complicated thing, he suggested I go somewhere else other than Kaiser. I'm not saying that's true because I know people who have been happy with Kaiser, but he's saying that HMOs can be very limiting. All right. All
And then
right.
back to her, if she's not using her plan and she's very healthy, consider getting the Give Back plan. That's a great way where you get hospital coverage and you get $164 back in your Social Security every single month.
Okay.
People who are
And you
relatively
can
healthy.
put that aside for, So Dee Diaz says she thinks that the Advantage plans are great in California and Florida because she has the opinion that they're better in states where there's a lot of retirees. I don't know. Maybe so. I don't know. You know. All
Yeah.
right. Well, thank you, Greg. You've given us so much more time. I said an hour, and here it is almost an hour and a half. So thank you so very much. And I appreciate your time on a Saturday when you could be spending it with your family in a beautiful day in California. But thank you so much, and I hope maybe the doors open if some things major change, because between 2024 this year and 2030, they're projecting that over 30 million people will hit 65. So it's going to be, I'm in fact, I'm going to do a video maybe on that next week about what I think, this is going to be huge, and, but anyhow, thank you. And hopefully the doors open. If we have any questions in the future, maybe some months downstream, you'll be willing to maybe come back again.
I would love to. Thank you, Carol.
Thank you so much, and have a wonderful the rest of your Saturday.
Everybody, you guys have a great week and enjoy the rest of your weekend.
Thank you. Bye-bye.
Bye-bye, guys. Bye-bye.
All right. Well, I think that, I don't know about you guys, but I think that was a very worthy and worthwhile discussion. And I hope you got some benefit from it. If you need to call and ask Greg questions, he's graciously said he would answer them. He is in California, though, but he does know some people out of state. I guess he can make some referrals. But I just so appreciate him. The reason I picked Greg was because someone I know had been with an agent for many, many years who was just an expert and had a lot of doctors as clients, and had worked with and retired, and recommended Greg, said he was just so knowledgeable and absolutely great. So he referred his clients to Greg, and my friend has been working with Greg, and she was just so happy with him. So I thought, well, let me give him a call, see if he's willing to do this on a Saturday. And he was. So if you guys have other topics that you'd like me to bring in some experts to answer questions and to go over things, let me know. Let me know in the comments, on this video, on other videos, go over back to the replay, put comments in there too. Let me know, because they're experts on all of these fields. And I am going to do a video next week on some things I think are so important, with so many people going onto Medicare over the next 6 years. I have some major concerns, and I'm going to address those in the video. But let me go and see. Yeah, I'm sorry I didn't get more, but I had promised him only an hour, and he graciously stuck around for an hour and a half. But how is everyone else doing? Lindy, how are you doing? Oh my goodness, I'd love to bring Lindy up. Lindy, are you still here? Let me know. Yes, you can pick different Advantage plans. That's my understanding, Carol Crane. You can. Nora said, Tim, that's why she puts up with you. I put up with Tim because he's my good friend. And he makes me egg rolls from time to time. Oh my goodness. Yes, Teresa, I am doing okay. Still have I have to have another CAT scan, but I'll let you know what's going on. We don't really know what's going on. So I tell you, it's like, you know what I feel like? I feel like a car that, all four wheels went poof, and the car fell down to the ground, So all my parts are old, so they're wearing out. So I may have to get some replacements one of these days. I'm thinking, I don't know. All right. So you guys have Greg's number there, and thank you, Nora, for adding that. Let's see. Yes, thank you so much, Greg. Let's see. Yeah, Linda, I'm just, I just want to, when my doctor said that to me about, well, you can't go to that, you can't go to that hospital unless you have, basically the right insurance. I was like, what is she talking about? And that made me start looking into it. And I found out, you could not go to a specific hospital that you want to if it's dropped certain plans. So yeah. Lisa said, Nora, I stopped when I saw Carol doing it. I don't know what I'm missing some of the chatter, but that's okay. Yeah, Miss Net, you know what? I just want to encourage people to do some research and talk to someone who can answer your questions. When I signed up for Medicare, I didn't do it. I had my insurance agent handle it for me because I was like, you know what? I will mess this up and I will be messed up forever. So I had him handle it, and I'm now going to have Greg go back and review what I now have, because open enrollment is coming up in October. So I'm just going to have him look at it and maybe tweak a few things. I just forgot to add, he was telling me that there are plans that you can pay a nominal fee per month. You can have cancer coverage, and you can also have coverage that will pay your hospital copay if you're, but I don't know. But those things, I don't want to get into those because I don't really know about those. He's the expert. So let's see. Very good show. Thank you, Rose Grace. I'm glad that you found it helpful. Linda says, I can finally chat now. Thank you. This is important. I do have to sign up for an online account by August 3rd. It's something new. August 3rd. You know what, Linda? I don't know. And Greg's gone, but call him and ask him. He's probably going to go, Carol, why are you telling all these people to call me and ask me? But I can't answer that. So I'm not going to give you a guess, because if you, I'm sorry, August 31st. Well, that's coming up. So I would call and ask, especially if you're in California. I would call and ask. I don't, yeah, some of these things can be real serious. Yeah, Lindy. Lindy, would you like to come up and give an update on how you're doing? I don't want to put any pressure on you if you, but I'm going to drop a link. And I'm going to try and drop a link. I already was able to successfully drop a link once, so I think I can do it again. Well, hallelujah, praise the Lord. I dropped a link. So, Lindy, if you would like to come up, if you're still here, but I don't want to put any pressure on you because I know you're resting, and this week you weren't going to be, doing a lot on YouTube. But if you want to come up and just say hello to folks and tell them what you're going to be talking about in your live, you're welcome to come up. I dropped a link. RV Grandma Charlotte says, I highly recommended finding someone in your state to help. Yes, I do. I use a woman at senior benefits. Absolutely. Whatever state you are in, find someone, maybe through referrals. But here's what I would caution you. You need to find someone who has a lot of integrity. And I'm going to tell you something. I was listening to another person who's also a licensed insurance broker, and he was saying Medicare Advantage is really promoting their program. They have a lot of, celebrities like Joe Namath, what's his name from Good Times, all these people pushing Medicare Advantage. Well, he was saying that he gets paid, and he acknowledged this and admitted it. So I think that suggests that he has good integrity. But he was saying that he receives a commission of 2 to 3 times the amount if he signs someone up for Medicare Advantage versus some of the other programs. So there could be a little bit of a conflict of interest if you don't get someone who really has high integrity, because, if they're making more money putting you in one plan, and I'm not saying there are a lot of people who would do that, but I'm just saying, make sure you get someone who is not only knowledgeable, but has high integrity, and will put you in the plan that is best for you. He said his number incorrectly. Let me look and see what his number is. Well, I will, well, I don't know. I'll have to call him and see. I don't know. I can't answer that. I just know what number he just said, and I'm guessing he knows. I was going to look up his number, but I may have his private number, which may be different from his business number. So, but I will go back and see about perhaps adding that to the description for this when I get a chance. But yeah. Oh, Okay, Lisa said she typed it wrong. So please only go by, Lisa, please only go by the number that I gave for Greg. Please only use the number that I used for Greg, okay? Um, that's the correct number, so go back and let me see if I can find the number that I gave for Greg. Hold on. Oh my goodness. Lisa, I know you're trying to help, but okay, I'm trying to see if I can find the number that I gave for Greg. Oh my goodness. Can one of my moderators put in the right number if, oh my goodness. All right, well, I can't find it. I can't go back, but whatever number I gave, that's the correct number for Greg, okay? And sorry if you got the wrong number. Let's see. Uh Nora says marrying someone is too high a price to pay to get medical coverage. You got that right. Uh uh Mo Bang says I already tripled that time, 32 years. Well, congratulations to you, Tim. You have learned the secret. Happy wife, happy life. I think you have learned the secret from what I've seen. All right, I think I've got everyone, and Lindy doesn't look like Lindy's coming up, but that's okay. Susie Aspen says I've gone back and forth. Yes, you can. Be anxious for nothing. Christine from Maine says howdy. Hello. Uh, Lindy says after 2 cancers, they wanted $500 to $600 a month to change back to regular Advantage, and she could not afford the supplements. Wow. Yeah, that's $500 to $600 a month. That's pretty pricey. That is pretty pricey. Be anxious for nothing says I have 10 months before I figure this out. Well, good. You can do your homework and make sure you get it right. Yeah, that is horrible, Lindy. Oh my goodness, for regular Medicare with a supplement. Yeah. All right. Yeah, Mobang Tim says don't have cancer with Kaiser. Well, I'm gonna tell you something. Don't even have a problem with a gallstone with Kaiser. Here's my story with Kaiser. I went to Kaiser and I had by ambulance. Now, for me to go by ambulance, anyone who knows me, this is when I had to pay for the ambulance. If you know me and you know how frugal I am, I have never called an ambulance in my life. I was in such excruciating pain. I literally thought I was done for. I called the ambulance. I left the door open and I was practically passed out. I went in my pajama, my nightshirt. I mean, I was a hot mess. I didn't care. I asked them, I said, I need you to run this test. They didn't do the test I asked. They said, oh, it's just gastro. I don't know what they said it was. Well, it was not. I had gallstones. They didn't properly diagnose it. I had another attack, and that could have killed me because one of the stones lodged in my pancreas, the duct to my pancreas. The doctor that I finally went to, because I changed plans and got out of Kaiser, he said, this is so ridiculous. He said, this is about the most simple thing in the world to diagnose. All you do is you do an ultrasound. He did blood work, which showed that my kidney levels, liver levels were way high, creatinine or something. Liver levels were really high. And he said, okay, you either have hepatitis or you've got gallstones. I mean, just like that. Very simple. Great internist, got a sonogram, instantly was able to diagnose, went into the hospital, got it taken care of. But by that time, it had got lodged in my pancreas duct, and that could have killed me. The simplest thing, according to this internist, the simplest thing in the world to diagnose by having the blood work, which I asked for and they didn't do, by having the sonogram. So I'm sorry, if a physician cannot diagnose something very, very simple, how are they going to diagnose and treat something more complicated? So I immediately changed from Kaiser. I've never gone back. But that was just my experience. I have spoken to people who are very pleased, and I've spoken to people who have even worse stories than mine. So you tell me. I don't know. But, if I have to go pick up cans to get some money, I'm going to try and keep the plan that I have or something similar. But I don't know. Lindy says, if you're not healthy, you will not get back to regular Medicare. Yeah, you won't get back, except, like he's saying, on some plans, if they have a holiday. But he did say there's a 6-month, but they can charge you an arm and a leg. But there's a 6-month. But I would, again, call him, find out, get on a list if you want to go back. Get on a list so he can call you and let you know when they're having one of these holiday periods where they will take you back without any underwriting or any asking of questions. But like he said, it's been a very long time since they've had one. And I believe that those gaps in between are going to get further and further, and they may eventually completely eliminate that as 30 million people get on to Medicare, 30 million more. But I would call him and ask him, hey, even if you don't go through him, ask him, hey, give me a call when they have one of these holidays so I can get back in maybe at a decent price. That's what I would do. But yeah, it's people, you don't know what you don't know, and that's why it's so important to. And it's not just Medicare, or it's not just healthcare. It's so many different things. I have certain things I'm really good at. I have a lot of knowledge about. Anything else I consult with an expert on, All right. All right. You're welcome, CJ. I think I've pretty much spoken and greeted everyone. Yes, Greg's number. Let me see if that's the same number that I have. 310-402-3798. Yes, that's the right number. 310-402-3798. All right. Well, folks, I am going to get out of here. Jay's at a birthday party that should be ending any minute, and I've got to go over and pick her up. I know I'm way behind in comments, way behind. I'm going to try and make sure I've said hello to everyone. Yeah, you should check your plans yearly because they can drop in and out, and also they can change the terms and conditions of them, all right. I think that's it. Whew. And no, I'm not in that line of work. Who's in DD? Oh, DD, for DD Diaz. Okay. Lots of competition. Okay, in Florida. Well, that's a good thing. Competition, seems to make people do a little better and have other other options available. All right. Yeah, you did correct it. Thank you, Lisa. Okay. Yeah, no pay for you this month, Lisa. Oh God. All right. But thank you for correcting that, Lisa, and thank you for wanting to help by putting it up to begin with. All right. Oh yeah, Rose Grace gallstones. Oh my gosh, I thought I was. I was passed out by the time they got me in the ambulance. I don't know how. I don't know how some doctors made it through medical school either, Carol Crane. I don't know. I'll tell you. All right, yeah, Tim. Uh Oh, Kaiser, my brother met his ex-wife working there. Well, that's an ex-wife, so I don't know. I'm just saying it's an ex. Okay. Oh, you changed prior to your cancer. That was very fortunate for you, Susie. Oh my, and I hope you're okay now. RV Grandma Charlotte says she hates Kaiser. I've said enough. I don't want them to come after me, but yeah. Oh, your sister went to the ER after a TIA, spent 6 hours in the ER, never found anything. A month later, a stroke. Oh my gosh. Their carotid was blocked. Doctor said it could have been found with a stethoscope. I rest my case. And was it Kaiser that a man, I may be mistaken now, but I thought it was Kaiser that someone went to the emergency room up in the, I'll have to look, and was there for 8 hours with chest pains. Apparently, they didn't come back and re-triage him, and he died of a heart attack in the waiting room after 8 or 10 hours. That was a big story just a month or so ago. What can I say? I want to go to the hospital I want to go to, and I want my child to be able to go to the hospital she wants to go to. But anyhow, all right, guys. Good night. I am heading out. All right. Oh, good, Susie. That's yay. You got a clear PET scan last week. Okay. All right. All my moderators, drop your links because we're getting ready to head out of here. Drop your links. If there's any experts or any topic that you want me to bring someone in on, I know experts I don't know a lot of this stuff, but I know experts that I can bring in and address some of these questions you may have. So, in fact, I have I have a topic I'm thinking I want to bring an expert in to answer some questions and to share some things with you guys. A topic that may impact each of you, not medical, but something else. But anyhow, yeah, Kaiser makes you sign an arbitration agreement. Yeah, I can understand why. But all right, there's Nora dropping her link. Tim from Mobang from Your Bucks is a moderator. Go over and check out his channel, Outdoor Travels, Lisa, and she has her live tomorrow at 5 o'clock. Lindy from Lava Lindy. Oops, let me get this. So go over and check out Lava Lindy's channel, and she has some information on, she had a heart attack. So she has had cancer twice, 2 different cancers. So go out and check Lava Lindy's Awesome Van Adventure. Nora from Arcuda 2001, check her out, Nora Keg at Etsy. Just amazing artwork, very talented. And guys, I'm gonna get out of here and love each and every one of you. I have some videos coming out, and I'm not gonna do a political video next week, but I am gonna briefly talk about something that's related to politics, but it's not political. You'll see what I mean when I do the video next week. But these are times that seniors need to be mindful and aware, because there are a lot of things that are going to be impacting us as seniors. And I'll be addressing that in a video coming out either Monday or Tuesday of next week. All right. I love each and every one of you. I will see you next week on the live next week. And next week, I'm trying to think I don't know. I have some other videos. I'm not going to say I'm going to do them because I'm not sure I'll get them done, but I will see you. Lindy's channel. Thank you. Thank you, Lisa, for dropping the link to Lindy's channel too. All right. I will see you guys next week. Have a beautiful, beautiful rest of your Saturday. May your journeys be filled with joy and blessings. Until next time. And now I'm going to try and sign